So David, it's back to school. What you got in your bag?
Well, John, I got to be ready for my tests. I got my pencils for my math tests, and I got my specimen cups for my drug tests. Want one?
No.
Welcome to CareTalk, your monthly home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
So, John, another calm month in Trump land, except for firing people like the National Security Advisor. Is he going to start firing people in healthcare next?
Well, I think there's always a lot of turbulence in Trump land, but there's actually been remarkable calm on the management side with his healthcare advisors. And actually, he's had a lot of good instincts, but it doesn't appear that we're making much progress. And as you heard recently, he's going to have or unveil soon a phenomenal health plan. What do you think?
John, I just can't wait for that. Although I heard that Kellyanne Conway essentially admitted that it was just a lie, that she said this great plan is coming. He doesn't have any great plan. Republicans have had 10 years to come up with something that's actually the replace part of repeal and replace. They haven't done it. Trump's still focused on taking away health care from people, denying health care to immigrants at the border, closing down Planned Parenthood. No phenomenal plan of any kind is coming.
But don't you think it's sort of interesting, as I agree with that a lot of the things that he's talking about are things that actually are Democrat ideas, getting tougher on drug pricing, being more transparent, thinking about moving more care to the home dialysis, allowing Medicare Advantage plans to be more creative around solving social problems. What's interesting is where you're seeing progress is around things that were historically Democratic agenda items. But I'm with you. I'm a little bit skeptical that we're going to get any plan. But if we were to make real progress on drug pricing, I think that could be a real bipartisan success.
So, John, as crazy as Trump seems, I think it's actually a smarter move to have work on specific things than promise something like Medicare for all.
He's smart?
I didn't say anything. I'm sure it's not on video. Now, John, you're a little bit testy, and so I'm sure you're in favor of drug testing for school kids. You know, there's 38% of school districts test kids for drugs.
What's wrong with a feedback loop that can actually reduce the number of kids who get hooked on drugs? How can you be in favor of a system where parents don't know, counselors don't know, and kids can't get help? Are you against kids, David?
That must be me, John. I'll tell you what, there's all this idea that, well, kids don't know how to read. They don't know math. So let's test them more. And this is the same sort of thing. Kids are on drugs. Let's test them. School's supposed to be about education, John. What happened to that? You know who's actually smarter about this than the schools is actually the NFL. Instead of just punishing people.
Which they do every Sunday.
Yeah. Fine. But instead of punishing people for using drugs,
yes,
and sending them off where they can use more drugs,
they fire them,
They bring them back in and they let them play and they let them be supervised. Kids who are kicked out of school, they're going to hang out and do more drugs, John. Stupid idea, drug testing.
The reality is that schools that test, middle schools that test, have a 25% lower rate of kids, preteens and teens, getting hooked on drugs. I don't see how this NFL defense against helping kids. It's a public health issue. You're taking the wrong side on this one.
All right, John.
But speaking of things you've taken multiple sides on,
yeah.
What do you think of medical tourism? And I want to exclude your personal experience and just talk about whether you think medical tourism is a good idea and whether it's a growth idea.
I love tourism, John. I love to go and see all the palaces and things like that. And while I'm at it, I don't have tear my heart out at the same time with the surgery. Medical tourism is a thing that people love to talk about. Journalists are always writing about it. This guy went to India and he got his hip replaced for 90% less and he came back. Well, guess what? Of the 2 million people that supposedly leave the U.S. for medical tourism every year, most are going for a nose job, some cosmetic kind of a thing, or they're going back to their home country where they actually have coverage or where it's affordable. It's a bunch of hyped up nonsense, John. Most medical tourism, the number one destination is still the good old US of A because we have the best and the brightest and the expensivest.
Well, but don't you think it would be a good thing to have an international market around high quality healthcare? There's some phenomenal things going on in simplifying, automating, and making more predictable eye surgery in India. You see some phenomenal science and medicine in Northern Europe, whether it's the developing world. There's some great science, but there's certainly in Europe, they are doing great work at half the price with better outcomes. What's wrong with creating a market for healthcare internationally?
I don't want to market, John. If I have a problem, I just want to get it fixed. I don't want to be part of some kind of a
you can't
market
afford.
system. I'm certainly not going to go to Europe.
Can't afford. I don't know.
All right. So, John, they do have domestic, and it's not medical tourism. It's more about centers of excellence, right? Mm-hmm. That makes sense. If you're going to be somewhere that doesn't have the best surgeon, go somewhere else where either they have a better surgeon or where they'll say, you know what, you don't actually need surgery. So that's not medical tourism. Centers of excellence. I'm with you for that. It's not as exciting. Complicated. Sorry, John. I'll keep it simple for you next time.
So, David, what do you think about all these opioid manufacturers and distributors and everyone getting sued?
John, if you look at the numbers, they're just eye-popping. You know, in Oklahoma, which isn't such a big state, Johnson & Johnson had an award against it for something like $500 or $600 million, which seems like nuts if you multiply that across all the states. On the other hand, 70,000 people died of drug overdoses in the most recent year, which has doubled from 10 years ago, which has doubled from 10 years before that. And it's true, I think the damages are incalculable. I don't think we can sue our way out of this problem, however.
But I think aren't there really two different cases here? I think there's a prudent and sensible case to prosecute those manufacturers, distributors, marketers who promoted it as a non-addictive quantity when it is creating this monstrous plague on the U.S. society. And then there are those where they just happen to be involved somehow in the system, and there's sort of a chase for deep pockets. I think we ought to absolutely prosecute those folks who misled doctors and patients. And we should be spending as much money as we can to break the back of this growing healthcare crisis. There's just, I think we're trying to blame everyone who touched the distribution scheme. It seems kind of crazy.
Yeah, I mean, I think criminal prosecution is probably a good idea, at least for some folks. But John, here's a suggestion for you. Why don't you go stand under that tree for the lightning round?
I'm ready.
Obesity, John, a serious issue, but is it really a national security issue?
Of course it is. We're getting to the point where we're too fat to fight. 1 out of every 3 recruits is rejected because they can't even meet the minimum requirements of size. And of those serving, it's 1 out of 5 are hitting obese. That's crazy, and it's dangerous. We need a strong, lean fighting machine.
John, the crazy thing is in World War II, they rejected a lot of recruits because they were too scrawny. I think it's mainly a dining hall issue. They just got to cut down the plate size. John, the nursing shortage, is it real? Are you worried about it?
This nursing shortage thing comes up as a regular conversation every few years. No, we can recruit nurses from abroad. We can expand the schools locally. As the boomers age, we're going to have the real issue is I do think we're going to have regional dislocations. We'll have almost 50,000 too few nurses to serve California and 40,000 too many nurses in Florida. That's just a planning and management issue. This is not a problem. What say you?
So, John, I think it's actually been kind of a false narrative that's been put forward by the nursing school deans that want to recruit more nurses to nursing school and jack up the tuition.
And we love nurses.
Of course we love nurses,
we need more
John.
Nurses.
But I'll tell you what, with the immigration, if you crack down on immigrants, they're not going to be nurses. But what is going to happen is they'll be replaced with robots.
So, David, are you going to get your care at the UVA healthcare system?
John, I'm thinking about it because I saw that they kind of cleared out the deadwood, so to speak. They sued 36,000 patients for over $100 million, and it's sort of keeping people away, so I figure I'll waltz in there and I'll have the place to myself.
The Kaiser Health News really nailed it on this one. There are a lot of hospitals around the country that are taking advantage of their ability to sue people, but I think that the UVA healthcare system is remarkable. They sued for over $100 million. They sue for as much as $1 million, and they will chase you for as little as $13.91.
Yeah.
I mean, it is really crazy. They've even sued their own employees for back debts.
Nice.
This is a nonprofit. It's part of a university. It's appalling. And I hope that this system gets its act together because they actually do provide a lot of great medical support. There's a lot of great people trained there. This is unacceptable behavior. So, David, what's your back to school resolution?
John, I'm going to keep it clean, and I'm going to recycle by using these things as pencil holders.
I'm getting the new backpack.
Well, that's it for another edition of CareTalk. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching. Hey there, listeners. Want more CareTalk? There's more to be had in our other episodes, so be sure to look for those and subscribe to CareTalk on your favorite service.